Welcome to my channel, Phenomenal Private Practice with Amira Martin, where I focus on mental health, mental illness, and private practice building. I also give frequent doses of inspiration so you can hear about other practitioners with amazing private practice success stories and professional stories. So if you want to reach me because you have a question or you'd like me to create some content around your questions or something that you may be challenged with, feel free to email me at Amira@PhenomenalPrivatePracticeWithAmira.com. Okay. So today's question comes from a therapist. Her name is Jackie. And Jackie is a graduate student who is about to embark on her professional journey. She has about 2 months until graduation, and she's currently working in a mental health clinic. Jackie has been exposed to all sorts of patients and clients dealing with all sorts of different issues. And one of the issues that she has not seen much of is a client dealing with schizophrenia, right? So for those of you who know, I am a private practitioner and I do have a mental health practice. It's a very large practice, and I treat clients dealing with all sorts of issues. We do not specialize in severe mental health issues. We do not specialize in that, but I do have some information and I do have some background working with people who have this disease. And also I have relatives and people who have been close to me and friends who have developed this disease. So I have some knowledge about it for sure. So who is really at risk for developing schizophrenia? Well, first of all, we'll think of that in terms of numbers, right? If you don't have a parent or a relative with schizophrenia, you have a very, very, very low, small, minute chance of developing schizophrenia. I'm not sure what the exact number is, but it's tiny and it's highly unlikely. It does happen that a person can develop schizophrenia without any known relatives who have the disease. And that's viewed as a gene mutation as the cause, right? Our genes do mutate, they can mutate and cause someone to have schizophrenia without any other relatives having the disease. But if you have one parent, one sibling with the disorder, so a parent, a brother, a sister, a close family member, you have a 10% chance of developing schizophrenia. That's still relatively small, right? If you have two parents, so both your biological parents have schizophrenia, and depending on how it's carried, you have up to a 40% chance of developing schizophrenia, up to 40%, right? So somewhere between 10 and 40, depending on a variety of things. Now, this rate and the chance of actually developing schizophrenia goes up with a number of things, right? So while you're growing up, your adolescence, early adulthood, dealing with extreme stress, violence, physical attack, PTSD, other serious mental health issues, any sort of like extreme trauma, extreme neglect, harsh mistreatment, lack of care, that sort of thing. All those things that are really, really stressful and difficult that people sometimes unfortunately have to deal with in life, those all kick up the chances of developing any form of mental illness. And schizophrenia is not exempt from that. Now, when a person has schizophrenia, there are actual biological differences in the brain, right? There are differences in their brain where some parts of their brain are smaller, some are larger. The spacing is different in different sections than it is in people without schizophrenia. So it's really a physical disease, right? A lot of people who aren't aware of or have full understanding of the disease think that, people can be talked out of it, right? Like talk therapy can work and get you out of schizophrenia, or talk therapy can work and teach you how to do X, Y, and Z. And while talk therapy is super helpful, so is medication. Medication, when it comes to some mental health issues, is much more important and much more useful than anything else. Schizophrenia is definitely one of those mental health issues where a person would need to take medication and would need to see a psychiatrist ongoing and should really be ready to accept and work with their practitioners around accepting this diagnosis and what their prognosis is, right? So some of the possible causes, again, for people who don't have that family history, right? Some mental health providers have studied it in the past, scientists have studied it in the past, and found that viral infections in utero are possibly a cause, an additional component to why people might develop it. Proper nutrition, your mother, your biological mother rather, did she get proper nutrition during pregnancy, especially during the first 6 months of pregnancy when everything is really forming and coming together? Studies have also shown that taking drugs like methamphetamine or LSD, even marijuana use, increases the risk of developing schizophrenia. So while marijuana is legal and lots of people are celebrating that, a lot of people aren't, because there's potential major ramifications in the mental health of many, and people aren't always aware of that and don't have a full understanding of that. So some things to think about: the younger a person starts abusing any sort of substance, the more likely they are to develop this illness, especially for LSD, marijuana, other substances. The younger a person starts, the more likely it is to happen, right? Obviously, it doesn't bring you to like 80, 90% range, but it adds a few percentage points that you might not want to have there. So what does schizophrenia look like, right? And what are people experiencing when they have it? Well, there are different types of schizophrenia, for starters, right? But all types of schizophrenia are severe and all cause severe distortions in thinking and and telling what's real from what's not real, right? Which is a massive problem, right? So people who are dealing with schizophrenia will have issues with their senses. They may feel things that are not there, right? So you could feel a spider crawling up and down your back. You could feel someone hit you in the back of the head, and those things may not have happened. Hearing things, right? So auditory hallucinations, right? Tactiles, the feeling of feeling the things that aren't there. So tactile hallucinations, auditory hallucinations, hearing things that aren't there. So you could be hearing a voice whispering that's not there. You could hear someone yelling, screaming at you, and it not happen. You can be in another room and you have a family member in a different room, and the person who has the illness thinks that family member called a curse word or an angry name, right? There are also differences with what people see. You can visually hallucinate and see things that aren't there, right? So you're sitting at your dining table, you see somebody walk in, stand over you and say to you, "You're the only one who can see me here. The others can't. And if you say anything, I'll kill you." Like, it's really be a really frightening process, but that's the sort of thing that they can experience. And then also olfactory issues, right? So smelling things that are not there. Gustatory issues, so tasting things that are not there. And just believing that you're in places and situations that you are not in, right? So a possibility is like driving down the highway and there's a car behind you and you think that that car has been following you for the last 90 miles, and you turn off and you see them turn off behind you if if you're dealing with this sort of hallucination, and none of it's real, right? But you can't talk a person with schizophrenia out of it. The best thing to do is to be honest about what's happening, right? It's not a good idea to agree with the person who's dealing with this sort of thing and say, "Yeah, you're right, I saw that too." It's not useful. The best thing is to get psychiatric help for them. Get them to a psychiatrist. Get them to a medical doctor if you're not sure how to get to a psychiatrist. If this is your patient or client, ensure that they have a psychiatric assessment as soon as possible. This is absolutely key, right? So what is the outcome? What's the prognosis, right? Well, one is that people with schizophrenia do need to take medication, absolutely necessary, and will always be necessary, right, for that person to function. The sooner a person with schizophrenia begins treatment, so the sooner they start medication, and remember, medication is key because that stops those changes in the brain. It stops them from being affirmed, so to speak, right? Like those pathways and changes in the brain, you want to stop that, and you want to allow their brain to return to as normal a state as possible. So when they're taking medication, that does that. So the sooner a person with schizophrenia begins treatment with a psychiatrist and possibly with medication, right? Again, the more likely they are to have a positive outcome, right? The longer it's untreated, the harder it gets to treat. and the harder it gets to get back to that higher level functioning, okay? Someone's schizophrenia symptoms at age 16 will be significantly worse at age 27 if they spent that time being off medication. If they were on medication and in therapy, they have a much, much, much more positive prognosis and can do things that, you know, we all want to see our friends, family, community members, clients do, right? Like have richer lives. It's possible with the right help. If you have a client who has schizophrenia and is on medication and doesn't like the way the medication makes them feel, you can always have them speak to their doctor about that, right? Just like any other illness, medication management with schizophrenia is very important. So dosages may need to be changed. Things may need to be decreased. Things may need to be brought up. They may need to add other meds, remove meds. It's never the case that as soon as you get one medication for a mental health issue, or your client gets a medication for a mental health issue rather, it's never the case that this is it, that they just have to take that and that's it. It's always the case that they should go back and have their follow-ups with their doctor, talk about how they're feeling, and talk about ways to alleviate those side effects from the medications, right? It's very important in order to help them to maintain treatment. Because those medications can be really hard to deal with and heavy system that's not used to them. But over time, your body does adjust. And over time, you can also learn the things that are necessary to help you adjust. And your doctor also might have some changes in mind for you based on what your client is saying. So if you are thinking that this might be something that you or a client is dealing with, make sure to speak with your supervisor. If you're, get professional help. Please think about subscribing to my channel, right? I'd love it if you'd subscribe for more information like this. And again, email me at Amira@PhenomenalPrivatePracticeAmira.com. Email me your questions and comments or put them down below. I'd love to help. Now, have a great day and please continue to take good care of yourself.